This is Jeff Bourgeois with San Juan Regional Medical Center. I have the pleasure of being joined today by Dr. Brad Greenberg and Dr. Robert Underwood, and we are here together to give you a brief update about activities at the hospital as it stands today. First, I'd like to begin, as I always do, thanking each and every one of you for your continued support of our facility and, more importantly, our caregivers during this unprecedented time. We would like everyone to know that we continue to maintain our commitment to provide service to our community, and thanks again for your continued support. A brief update about the activity level at our hospital today. As of Friday morning, October 22nd, at roughly 6 a.m., we had a total of 153 patients in our hospital. 66 patients of those were either COVID positive or in the process of being ruled in or ruled out. We had another 13 of those patients total intubated, 9 of those intubated patients being COVID patients. So all in all, a very busy hospital, but not quite as busy as we've been the 2 prior days. So let me transition now to Dr. Underwood, and I'll turn it over to you. Thank you, Dr. Underwood.
Thanks, Jeff. As Jeff said, I'm Dr. Bob Underwood. I'm the Chief Medical Officer at San Juan Regional Medical Center. A couple of things that have happened in light of how busy we are as an organization, and this being a statewide phenomenon. So earlier this week, actually on Monday, New Mexico issued basically 2 primary documents. One is an executive summary from the governor that says that there's criteria which may require crisis standards of care, and then another one from the Department of Health, which talked about more of the mechanics of how that will take place. Essentially, the physicians will get a certification at the state level, and that will allow them to work outside of their normal scope of practice, which is kind of important. Crisis standards of care means that we're operating in a position where the demand may exceed the capacity. And so we would take on different areas of how we would try to make sure that we can expand our capacity the best possible to be able to care for that extra number of patients that need care. This can be in terms of bed space, provider capability, number of doctors. And so that's how it would look at our facility, is our physicians may be working a little bit outside of their scope if that is declared. That has not been declared at San Juan Regional Medical Center yet. So it is something that we are looking at and deep diving into the legal and other ramifications of what these documents really mean and what crisis standards of care really mean. With that, I'm going to turn it over to Dr. Greenberg, who will talk a little bit more about a situational update and maintaining our resources overall, kind of following on what I just pointed out. So, Brad, over to you.
Thanks so much, Dr. Underwood. Brad Greenberg. I'm the Medical Director of Emergency Preparedness at San Juan Regional, and I wanted to let everyone know here that we also these are interesting and trying times. You know, the burden of illness in our community is high. The percentage of our positive tests is coming back between 16.75% and 17.36%. Our case rate per 100,000 also very high, 90 per 100,000. So we have a lot of illness in our community. And also throughout the state, the entire state remains somewhat saturated when it comes to capacity for ICU beds. So locally, we have some challenges. Across the state, we have some challenges. Now, as we try to rise to the occasion for that, we always consider what resources we have available to us. We're doing great with personal protective equipment. We have plenty of those supplies. We have plenty of tests. But there are some challenges that exist in the supply chain that those of us at San Juan Regional Medical Center are working very hard to anticipate and respond to make sure that we have the right equipment to take care of you. We do have adequate space, but the real challenges here are about personnel. And, you know, we are asking a whole lot of all of our team members. The healthcare workers here have been working so hard for 2 years. So I would ask each and every one of you to understand that and to appreciate any friends, family members, or members of the community that are healthcare workers, because they need your thanks They need your support. And we are all going to get through this. We're going to get through this as a community. But please remember, getting through this as a community really is the sum of all of your individual choices. So please make good choices. Wear a mask, wash your hands, appropriately socially distance. Please, please, please get vaccinated. We're going to get through this. We're going to be stronger for it, and we're going to be there for you. And I'll give this back to Jeff. Thank you.
Thank you, gentlemen. Appreciate your continued leadership throughout this pandemic for us. I just want to close briefly by saying thanks again. In addition to the COVID vaccine that Dr. Greenberg mentioned, we are hosting at San Juan Regional Medical Center tomorrow on October 23rd, and again the following Saturday on October 30th, a drive-through flu vaccine clinic. You can go to sanjuanregional.com and you'll see the banner at the front of our homepage about our flu shot drives, and encourage everyone to come get a complimentary flu shot. It's easy drive-through, and another opportunity for us to help protect our community and promote good health. And finally, if you need care of any type, do not delay care. Seek out your primary care provider and don't put off your healthcare needs. We've seen far too many people present with late-stage diagnoses as a result of delaying care. And please take advantage of the wonderful physicians and other medical providers in our community to help guide your health. Thank you all again for the wonderful support you continue to provide San Juan Regional Medical Center. Have a great weekend. Thank you so much, everyone.